Okay guys, Timmy coming at you again. So what I'm going to do today is I'm going to go over the respiratory system with you guys. All right. Now a couple of things. Watch. These are the functions of the respiratory system. Its biggest one is to exchange carbon dioxide and oxygen. And remember that you make CO2 as a byproduct of metabolism at the cells. So you have to get rid of CO2 in the lungs. And with that said, the respiratory system helps maintain the pH of the blood. And it does that by eliminating CO2. And if you write this down, it'd be very good for you. CO2 is an acid. So if the lungs are failing, they're not getting rid of CO2, that's going to drop your pH. The other thing that the respiratory system does, primarily the upper respiratory system, is it warms, filters, and humidifies the air. So that by the time that air gets down to your larynx, that little voice box, it is warmed to 98.6. It is filtered of all bad stuff, and it is 100% humidified. So if we look at my uncle here, right, had a bad day. I'm going to give you some of the structures of the upper respiratory system. Now, our air typically comes into the nose, and then you have the nasal cavity. The nasal cavity has some structures called concha. And basically what concha do is they create turbulent airflow. Now, turbulent airflow is needed because there's a lot of mucus in the respiratory tract, and as we remember from the discussion of the cell, that it has cilia. So that mucus and that turbulent airflow allows air to be filtered when you take a breath in. So here you have the nasal pharynx. Pharynx is throat. So the pharynx is divided into three parts: the nasal pharynx, then the oral pharynx, oral mouth, and then the laryngeal pharynx. So those are the three parts of the back of your throat. Now look, bad stuff can come in, right? You can breathe bad stuff. So in the back of your nasal cavity, you have lymphatic tissue called adenoids. And adenoids destroy any potential harmful stuff that you've inhaled through, through your nose. Then you have the tonsils that are lymphatic tissue that protect your oral airway. The oral airway. So these are some of the structures of the upper respiratory system. And remember, the upper respiratory system tract is designed to filter, warm, and humidify the air. Now watch. Separating the nasal cavity from the oral cavity is the hard palate, which is basically made up of the palatine bone. Then you have this piece of cartilage in this little punching bag. That makes up the soft palate. So the soft palate and the uvula are designed, their function is to direct food from the oral cavity into the esophagus. You don't want to be sucking your strained peas into your larynx. So with that said, when you eat, there's a thick piece of cartilage that will cover over the larynx, and that's called your epiglottis. So the epiglottis closes off the larynx when you're eating, and that prevents food from being sucked into your lungs. And if you suck something that ain't air into your lungs, that's called aspiration. Now, you also have within the upper airway, you have your sinuses, and there are 4 pairs of sinuses, and you should become familiar with that. You should become familiar with the 4 sinuses, the 4 pairs of sinuses. And a couple of things about the sinuses. Number one, they reduce the weight of the skull, right? They also allow for changes in atmospheric pressure. That's very important. And this is critical. The lining of the sinuses is similar, if not identical, to the lining of the respiratory tract, meaning it has goblet cells that secrete mucus, and it is ciliated. And there are also tiny holes in your sinuses that allow mucus to drain into the nasopharynx. So if you get sinusitis, basically what happens is that very vascular lining within the sinuses becomes inflamed, all the arteries dilate, they block off the ostia, you still continue to produce the mucus, but you can't drain it, hence the sinus pressure and pain. And trust me, I know about it. I just experienced it this weekend. All right, so let's take a little deeper look at the respiratory tract itself. So we got through the upper airway, got through the larynx, right? And the larynx is a tract attached to the big breathing tube, the trachea. So the trachea is made of C-shaped cartilage rings. And the reason they're C-shaped is because directly in back of that is the esophagus. And when you eat, that esophagus expands. So if it was O-shaped, you'd be feeling that food moving all the way down as it rubs against the rings of the trachea. So once air is taken in, it's going to go to the main stem bronchus. And you have 2 main stem bronchus because you have 2 lungs, right? 2 big lungs. Then each lung is divided into a lobar bronchus, here and here. Now, the right lung has 3 lobes and the left lung has 2 lobes. And the reason for that is that the heart sits mostly in the mediastinum, but it's more left than right. And as you can see, the left main stem bronchi is much more acute. The angle is much more acute than the right. Then each lung, or each lobe of the lung, is divided into segments. So then you will have the segmental bronchus. And then finally, you get into the smaller airways called the bronchioles. Now, what's really important is that as you move from the upper airway to the lower airway, the amount of cartilage within the respiratory tract, the airways themselves, decreases. And what's important to know is that the bronchioles are made of smooth muscle. And we learned that muscle can do 2 things, contract and relax. So the bronchioles, in many respects, dictate the resistance to airflow. And if you know anyone who has asthma, you know exactly what I'm talking about. Now, each bronchiole is then connected to an alveolar duct, and the alveolar duct is then connected to a grape-like sac of single cell membrane, thick air sacs called alveoli. So the most important part of the respiratory tract is where the rubber meets the road. That's where the pulmonary capillary and the alveoli meet. So if we look at it here, what did I do? Hang on a second. Okay, now look, if You recall from our study of the cardiovascular system, we talked about the fact that all venous blood from the body returns to the right side of the heart. And the right side of the heart is then going to take that venous blood, which by definition is high in CO2 and low in oxygen. So the right heart's going to pump that blood through the pulmonary trunk, the left and right pulmonary arteries, the pulmonary arterioles, and then finally you're going to get down to the smallest airway, the pulmonary capillary. And this is important. Each pulmonary capillary within the lungs is associated with an alveoli. Sorry about that. So just like in the cells of the body, that every systemic capillary is associated with a cell, in the pulmonary circulation, every alveoli is associated with the pulmonary capillary. So if we do this, and we will do this, right? When you have the alveoli, this is what you're going to see. So you have the alveoli, one cell thick membrane, and then associated with it is going to be that pulmonary capillary. And the blood that is being pumped by the right side of the heart is blood that is high in CO2, right? And the air that we breathe is high in oxygen. And as a result, things always go from high to low because the pulmonary capillary is a one cell thick membrane and the alveoli are a one cell thick membrane. CO2 is going to leave and go into the alveoli, and oxygen is going to leave the alveoli and come into the blood. Right? Then we got the pulmonary capillary. So this is where gases are exchanged in the respiratory system. And this is also, if you read that book, that evil thing. The alveoli and the pulmonary capillary represent external respiration, right? Internal respiration happens at the level of the systemic capillary in the cell. All right, so now all that newly oxygenated blood that came from the lungs, right, is now all that venous blood that's coming back from the body. It's going to go to the lungs, right? Right ventricle, pulmonic valve, pulmonary trunk, left and right pulmonary artery, arterioles, pulmonary capillaries. And now that newly oxygenated blood that is now low in carbon dioxide is going to come back from the lungs through the pulmonary veins, enter the left atrium, mitral valve, left ventricle, aortic valve, and then down to the cells of the body. So that's the pulmonary circulation. What's important to remember is that as you get deeper and deeper into the lungs, the pulmonary vessels get smaller until they terminate at the level of the pulmonary capillary and the alveoli. And this is precisely where gas exchange occurs.